Welcome to Mental Health, a Crisis in Our Time. My name is Ann Bergen. I'm the host of this series of programs with the purpose of shining a light on the mental health issues that are impacting our country. I think, as I've said a number of times, epidemic is not an understatement when we talk about the mental health needs. I'm so honored today that I would be part of a very, very important conversation. My guests today are from the Ascend Hospice and Home Healthcare Group that is headquartered in Worcester. We often hear this quote, "Death is part of life as much as birth is." But I think the quote is a little incomplete because it doesn't mention sometimes the emotional turmoil, the grief, the pain, the fear, the loneliness, and the stress that is so often part of the journey at the end of life, especially for those leaving, but just as much for those that are left behind. There are angels among us who devote their lives providing compassionate care for individuals nearing one's end and the loved ones, their family members that so often need guidance, support, and a gentle hand to hold from time to time. Especially there are those who are desperate to keep family members at home who are living with a terminal illness. They don't want to have them go into a healthcare facility, a nursing home, but they get tired and they need help. The angels that are here today are ones who do that job. So I'm going to introduce them now. We have Allison Tambolio and Susan Dunshee, who are from Ascend. And I just felt, and I just want to welcome you both. I've had a little bit of a chance to talk to you before we started, but I want people to understand exactly what hospice care is, kind of a general picture and why it's so important. But before I start with that, that part of our conversation, I wanted you to tell me about each of you, sort of how you came, what your role is now, but then how you came to find this work to do in life, which is so important, and I'd imagine can be very, very emotional draining for you at times as well. So, Susan, why don't you start? Can you tell us a little bit of your journey of how you got to here and why you chose this work?
Sure. So right now my title is volunteer supervisor here in Massachusetts for volunteering. So I travel across the state looking for recruiting volunteers for
So the
Ascend Hospice.
state of Massachusetts, right?
Yes.
Wow.
Yep.
You cover a big territory. Yeah.
Yeah, we do. But pretty much what led me here, I have a background in special ed, so I was always working with children. I was fortunate enough to be a stay-at-home mom and then open an art studio. So I always liked working with others. And I had an experience about a year and a half ago. My mother became very ill. And she fortunately recovered, but she was in different facilities and the care wasn't that great, and I didn't know who I could talk to besides some family members. So that kind of geared me to this. But also back when I was in college at Worcester State University, I did hospice care, and that pretty much
As a
changed.
college student?
Right,
Wow.
right. I was probably either 20, 21, so that kind of broadened my eyes of, there's more out there in life than just what I was focusing on as
what
a
an
young
incredible
adult.
experience, though, as a young woman to have been part of that whole thing and to choose that as a volunteer opportunity.
Yes.
Wow, life-changing, really, right?
Yes, definitely.
Yeah. So tell us about you, Allison, your journey. And
So I am I'm a hospice RN. I started off as a registered nurse in a nursing facility. I went to home health, and between the nursing facility and home health, we had plenty of patients that were nearing end of life. They were declining. They needed extra support. So we worked with hospice in the facility, and then in home health, I had patients that were continuously being rehospitalized due to their disease process progressing, and refer them over to hospice. So working with hospice, I realized that it held a special place in my heart. All of these people that came in to assist us in caring for their, the patient and the person and the family. And so I decided that I wanted to give hospice a try as a nurse, and I fell in love with it. It is out of all the nursing hats I've worn in my career, hospice is definitely the most rewarding career for me. Hospice is definitely a calling for nurses, for social workers, for clergy.
It is a calling, isn't
yes,
it? Not
for
everybody
home
can
health
do it.
aides. Not everybody can do it.
No.
And it is a privilege to be a part of somebody's end of life as it is being present for someone's birth.
Yeah.
And not many people are able to be present for those times and those moments, but supporting, being able to help the patient be comfortable, you know, and giving them some quality of life and some dignity, but also working with the families and supporting them and helping them through, because who is left after the death? It is the family.
That's it.
And so, and it's a scary time. There's so many myths in hospice that scare people when they hear the word. But we go in and we help ease their fears.
When you said, I think one of the words that touched me is when you said dignity, because when I think about, like, when my dad going and just toward the end, this strong, beautiful guy, you know, and he was our hero and all that, and then you see him near the end of his life, and he isn't that man anymore,
Right.
and he was vulnerable, and he wasn't in hospice at the time. It was before hospice came in, but some of the people weren't so kind, you know, and they were rough with him, and I thought, oh, his dignity, you know, this is, but when you have people, you know, it's like, yeah, so you
it's
guys.
so important.
Right?
We really hold
Right?
that as one of the top tier
There you
things,
go.
that we're going to provide dignity to a person, because if people die alone in a room, whether they're home or in the hospital or in a nursing home, you know, that's sad, and we love to be able to go in and help support the facilities.
So
and
tell us
also
more
in
about
home.
that, because how hospice through Ascend actually works, so that you just don't go in, you go into home. Tell us about
Where we
where
do
where you
hospice?
go and how that works, and
Sure.
actually how someone would navigate or begin to find. So how does someone access hospice, and then what are the different where are the different places that you go? Can you help with that? So this whole
Sure.
navigation piece, yeah.
So accessing hospice is it's a very simple process. You can.
Well, that's good to know, because I don't think people know that.
They don't. So you can do it several different ways. You can call the hospice agency yourself and say that you feel yourself or your loved one is declining and may need some extra support. And then we would go into a conversation, because we don't need a doctor's order to go in and do a hospice info session. So we give people all the information of the things that we can
All
provide.
right, so you
and
don't
do.
need a doctor's order just to give the information. Okay,
Correct.
because good
Yes,
to know.
and there's
yeah.
no charge. It's free. Or you can call your primary care doctor and ask for a referral to hospice. You have the right to choose your own hospice. So, you know, you could go in, if you're in a nursing home and they use a particular hospice, or they recommend that hospice, and you want to use a different one, you have the right to choose
Okay,
that.
didn't know that. So you don't
Yes.
have to go to. It's not just the one. Oh, okay,
Correct,
interesting.
yes.
Okay, so you
It's
have a
always
right.
family choice.
Family choice.
Yes.
Okay, got it.
And we provide hospice anywhere the person calls home. So whether that's a nursing home, the hospital, for some reason they're in the hospital, we can go into the hospital too, and take care of the patient and the family there. Their home, even shelters. We can go assisted living facilities. So anywhere they call home, we can go.
Anywhere.
Anywhere.
Wow.
Yes.
Wow.
So it's we have 4 different levels of hospice care too. So there's routine care, where is the patient's, you know, not having a lot of symptoms to manage. The family's doing okay, caring for the patient. Then we.
Can you just tell me, when you say routine care, just give me an example of what that
Routine
would
is
be.
like we start off twice a week.
Yeah.
Because we're not there all the time, 24/7.
Exactly. Yeah.
Unless we need to be.
Right.
So we usually start off, you know, a couple times a week, and then as things decline or there's more symptoms to be managed, then we come in more often, and eventually it'll be daily.
So is it so with routine care, would it be like medical stuff? Would it be medical stuff? You get good. I've got a great terminology of medical stuff. Would it be someone who might help, in terms of like needing showering, or do
Oh,
you do
yes.
any
So
of
we
that
have,
stuff?
yes,
Yeah,
we have a
okay.
nurse that comes in, an aide. So the aide can help us showering. The nurse can help us showering. We have a social worker that comes in. We have clergy too. And you don't necessarily need to be religious to accept our chaplains. They're non-denominational. And if it's just to provide companionship and talk about the weather, then that's what we do. And we always recommend and encourage everyone to accept all of the services that we provide, because it's always extra eyes
Sure.
on the person, and they're able to recognize changes. So, because that's what we specialize in, we see when something has changed.
Got it.
And we know more things might
So
change.
you can say you might need a little bit more service. Okay, so we
Yes.
start off with routine care. Now to the next
Routine
level
care.
is
The next level would be, we have what's called continuous care, and that's provided, in the home or an assisted living facility where the patient's having a lot of symptoms that we need to manage, because there are a lot of symptoms that people have towards the end of life,
yeah.
that we expect to see. So that's when they need kind of a continuous, usually medication regimen. And then we have GIP level of care, which is general inpatient. So that's if there's someone in the hospital that is not stable enough to be transferred anywhere else, we will go into the hospital and we will help manage their symptoms there and keep them comfortable and support the family while we're there. And then there's a respite care. So if we have a person at home and the family is having a hard time caring for that patient, and they, or they need to have surgery or they're going on a vacation, then we can put them into a nursing home we go up to 5 days. Hospice covers the payment for that. And then, the family might have to pay for the 6th day, and then we go back and we can pay up to another 5 days of respite care. So it's kind of like caregiver burnout, because we also assess for that every time that we go in, because it can be exhausting, to take care of a
That's
family
what I've
member.
seen. That's what I've seen. But then I guess all along too, while you're at the different stages, you're also talking to the family members, and you're helping them understand what's happening at this stage, what's happening. You're not
Correct.
keeping them in the
Oh, no.
dark, right?
No, we're actually going in and we're educating to what's happening.
Yeah.
And what things that you would expect to see coming. So we don't want to be like, oh yeah, when we don't want to wait until it's happening. We want to let them know ahead of time. So because we're assessing for a lot of things. We're assessing for more sleeping, less eating, more withdrawn into themselves. They're not socializing as much as they were. They're needing a little more assistance in taking care of themselves, such as brushing their hair, getting dressed. So we're looking for all of these things. So we will ask, have they been having a hard time doing these things? What could they do a month ago versus 6 months ago? They can't do it now, but what could they do then that they can't do now?
Yeah.
So that's how we kind of gauge where we're at in the process.
So I'm thinking that too. I'm thinking about the skill that it takes to do your work as well, because I would imagine, and just family members particularly are under such stress, and they may not be patient, and they might be, are you doing enough? Or that you must have to have the people who work for you to have extraordinary patience, to understand all of that, right?
Yes, and we do. Yeah, because a lot of people, it's an emotional time.
Yeah.
So, I'm expecting someone to walk in and someone's very upset and they're frustrated and they're sad and they're scared. So we're expecting high emotions.
Yeah.
And, we're here to help bring those emotions a little bit back down and some comfort and just, all the emotional support on top of the physical support we're there for.
But when you think about it, it's physical, it's emotional, it's spiritual, because there's, it's when you think of the breadth of the services, that are offered there, it's really pretty amazing.
Right.
So in terms of this is a practical question, that insurance is, easy to access? Because I know a lot of people, oh, I can't afford it, or I can't. Can you help us with that piece of
Sure.
it? Because I think that's an important question people might have.
Yeah, so we accept several different insurance companies, but Medicare is the big one. Medicare covers the full hospice benefit. So, and we cover anything that's related to the terminal illness, meaning if you are coming to hospice with a diagnosis, for example, COPD, we cover inhalers, nebulizers, pain medications
Oh,
to help
really?
with breathing. Yes, we cover all of those.
I had no idea.
Yes.
Oh.
So, and anything that is contributing to the terminal illness as well. So there's different diagnoses that it's a grouping of diagnoses that is causing their decline. There's not necessarily one thing that is causing the decline. So, but if someone came on with cancer, they are stopping their cancer medications. So those are items that we do not cover as hospice because you're still seeking treatment,
Got it.
right?
Got
so
it.
we're not seeking treatment anymore.
This is probably a very dumb question, but you have to bear with me on this one.
Not dumb.
When I think about hospice, I think about, I mean, the people I've known, my parents and people now living, with dementia and things like that. But is hospice only for elderly, or is it?
No.
No.
Unfortunately, we've had
Yeah.
young patients too.
Yeah.
So young people have cancer, liver disease.
It's a whole set of other skills you have to
Yes.
deal with, isn't it, when you're dealing with young people and their
It's
families?
so different, yes. And it's much harder for families
Yeah.
and the person because they're so young.
Of course.
So you don't imagine that we would be in this situation. So that is a much different approach, and it's a lot of more emotional support and understanding of what's happening to the person, so we're sensitive in all cases, but
course.
those are a
Yeah,
little more
I was
extra.
thinking that
they're
would
a
be-
little extra
Of course
sensitive, and
they
they hit a
are.
little harder.
They are, because
know.
I'm sure there's also the element of denial, and you have to, I would imagine, have to face that and to say, oh no, they're going to get better, and then trying to just brace them and prepare. I mean, I can't even imagine. Yeah.
Yeah,
that's
it is difficult. Even we have families with a person who's 99 and they're still facing denial, which is understandable,
yeah,
right? Because
yeah,
they've
yeah.
just been here. That's just
That's it,
you,
and it
you
could be
expect them
exactly.
to always be there, and that's the hardest part. So
I know the conversations are always going to be different depending on the individual, but even sharing some of the if we home in and focus on the one who's nearing the end of life and who's in the need of the hospice care, what are some of the kinds of conversations that people who either volunteer or sitting with them or talking with them, and what are some of the kinds of emotions and concerns do those people who are terminally ill talk about with you? Can you share some of that?
the
or
person that's ill.
the person who's ill, yeah.
So
Is it fear? Is it?
it's definitely fear.
Yeah.
Some is denial.
Yeah.
And we just talk about it. I let them, explain how they're feeling, and sometimes they'll say I'm angry, or the doctor told me that, I have 3 months left, and then I ask how they feel about that. How does that make them feel, but at some point you do realize, even people who can't speak to you anymore, you see in their eyes that they have come to terms
Okay. Yeah.
with it and they've accepted it.
Yeah.
Some very much embrace it. Like it's like you're setting me free
Yeah.
to let me live the rest of my life the way I want to live, and you're not telling me no and shaming me for what I'm doing and how I want to live. And so I think at some point, usually the person with the illness is accepting what is happening, where the family still might be in denial. And that's hard.
But that, I was going to say, so maybe sharing some of the conversations that you have with the family members. What are some? I know from my mother, when the hospice person said to my mother, it's time. You can let him know that it's okay for him to go. And she said, why the hell would I want to do that? So, said, Ma,
It's true. This is so true. Yes.
she wasn't going with it.
Yeah, they're like, I'm not saying that. Yeah.
But I was just curious about some of those conversations that you have with people. You know, there are other ones. Because, you know, and as we're talking about this too, I think sometimes we think everyone had this loving relationship with a family member, and maybe there was, you know, maybe they have some guilt there, and there's some, wait a minute, I don't have time to, I'm just curious of some of the conversations that you've heard or had with people, you know.
So I have one that always sits with me a lot, and it was because the wife, it was a wife of a gentleman that was declining. He had dementia, and she was able to articulate very well to me what her thought process was, and she knew he was declining. She was a nurse, and as nurses, I think sometimes we're in more denial than anybody. But she was able to articulate very well. Like, she said to me, I'm having such a hard time. I don't know if hospice is the right choice. And she said, because he still has good days.
Yeah.
And so I smiled at her because she was able to articulate that so well in black and white, you know, to me. And I said, well, we want them to still have good days. Like, just because you need hospice doesn't mean it's all bad days from here. And the good days, we want to celebrate those more than we normally would, right? Because we have the gift of time is limited. We never know when it's going to be the last day, right? But we still want them to have good days. And we really like people to come on to hospice earlier when they're still having good days, because the medications we can use help give them better quality. So if somebody's, you know, having shortness of breath, they're not really eating because their brain is unconsciously saying, like, I would rather breathe than eat. So if we give a medication that helps them with their breathing, they're sitting up
really
happier and they're eating.
That you could get there earlier and help with a lot of managing all of these kinds of things, right?
Absolutely, because you don't realize as the family that, oh, they're probably not eating because they can't breathe.
Yeah.
You know, and, you know, we'll ask questions, are they having any trouble swallowing? And they'll say, oh, no, and any coughing or throat clearing after eating or drinking, and people will say no. And I said, well, sometimes it happens like 15 or 20 minutes later, so you're not really correlating the two, that it's something going on with their swallowing, where it puts them at risk for pneumonia.
Right.
And so your next visit in with the family, they'll say, oh, you know what, they were throat clearing, or they are coughing like 20 minutes after they eat or drink something. And so then we know we need to keep an eye on that and constantly be checking for pneumonia, because we will give antibiotics if we think there's a pneumonia brewing. But that, like I said, that conversation stands out to me because she was able to articulate very well that that's what her struggle was. And for many, that is their struggle, that they still have good days. And I feel like I'm giving up hope if I put them onto hospice, you know. And
that's really important, that what you're saying,
right. And it's not giving up hope. It's realizing the inevitable, because we're all guaranteed death happens in life. And we're going to have hope, but we're going to have it in a different way than what you normally think, right? So we're going to hope that we're going to give them the rest of their life is going to have some quality, comfort, so they can spend more time with their family, their friends, doing the things that they want to do, and instead of going back and forth to the hospital,
there you go,
to the doctor's office 5 times a week, you know.
Which is so draining.
Exactly, it is draining. And you spend your whole time doing that instead of just being able to enjoy the things that you want to do.
And I think too, I just remember in my own situation with my father, it was hospice helping to manage his pain, you know, so that he wasn't suffering. We just didn't want him to suffer, right? That's it. It's just, and you have someone there who's sitting there and saying, no, it's okay, you know, get this medication is good, this will soothe him, and this will be, so it's all those things, isn't it? And then I want to talk about the volunteer, the opportunities, because the need and all of that. But I had one other question. Hospice, once, you know, I don't know if you say the patient dies, you know, the terminally ill person dies, the family is left with a lot of emotion. Is that part of hospice? Is there any? Yes. Can you speak a little bit about that piece?
Sure.
Yeah, and then I want to talk about
So per Medicare guidelines, and I don't even like to say that because we offer bereavement services up to 13 months or longer if needed for the family. So we're continuously checking in with them, not to where we're obnoxious.
Yeah, yeah, no, yeah.
But we check in, we do our condolence calls, and then we call them again after in a month, and then we continue that on a schedule to check in to make sure that they're grieving appropriately, that they're not locking themselves up in their home and suffering from depression. And we have many resources that we offer to help them through if they're not grieving appropriately.
Yeah, because what I was thinking about just as you said that is that with senior citizens who've lost a partner that they've had their whole lives, and then I think we forget that they, behind the closed doors, what we're seeing now is that because substance misuse, depression.
Absolutely.
The highest suicide rate are men over in their 80s. They've lost a spouse. If we don't follow up, right?
It's true. It can be really scary for those people. And when you've been married to somebody for over 60 years, they're literally your other half, literally. And to not have that person anymore is really difficult for them. So we make sure that we are supporting them. We always say the grieving process starts the day of admission to hospice. So many times we're working through that prior to the death. So they are prepared in a way. I had a social worker once tell me that she was with a husband and a wife. The wife was terminally ill, and they were still younger, I think in their 50s. And she realized that the social worker realized the husband didn't know how to do laundry or cook. So she was
there you go.
working.
Yeah.
She made a special plan of care for him to help him.
That's great. Yeah.
Learn how to do all of those tasks on his own to make sure he was well prepared when she did pass. So we focus on all of these things. We try to individualize everybody's care, what they want, the goals they want to work on, and goals that we may assess might be necessary, and we talk about that, and we do add that to their plan of care to try to make sure everybody's well supported and well prepared.
That's huge. Yeah. But when you think about the work that hospice does, and in terms of needing people to be there and help support the work that you guys do, Susan, can you speak? You do the whole volunteer,
She does a beautiful
recruitment.
job.
Can you speak to us about that? What you do with that, and what the needs are, and then how people can help and what they can do to help you guys?
Sure. Well, I look at our volunteers as part of the care team. They're part of Ascend Hospice team. They're just as important as a nurse going
Absolutely.
in, the social worker, clergy. They're the eyes or the ears that are there maybe when, one of our nurses is not there, or a family member. You were just mentioning pain management. Well, we have one of our volunteers who reached out after visiting with a patient because the family wasn't there and said, I think she's having a little bit more pain than I've seen before. And right then and there, then I reached out to Allison and the team,
there you go.
and someone was there to double check on her. So they are part of the care team. So I like to say that to our volunteers all the time. To become a volunteer with us, it's pretty simple, just reaching out to us. And I like to have a conversation with the person to make sure they know a little bit about hospice and what to expect. And then finding out that a lot of our volunteers has had loved ones who have had passed away. Or
I would think that would be one of the motivating, that you know how valuable, say, I want to do something to help, right?
Right, and they're at the
Absolutely.
place now in their life where they can give back what they had received for their loved one. You have to do a little bit of training.
That's my question, training, I was
and
gonna
it's great. It's online, so we
Yeah.
make it really, really easy, and that you can do it on your time.
Yeah, because
so,
you don't want someone to, say something, the wrong thing. Yeah, so I
Absolutely.
mean,
Right.
So I was saying training would be so important.
Yes.
Right, so and they can do it on their own time. So
Yeah.
it's not like you have to get it done within 2 days. If you need several weeks or months
That's
to
great,
get it
having
done.
it online. That's
Yeah.
incredible.
Because we want them to be able to come volunteer.
So when you the different ways someone could volunteer, I'll give you an example. Like one of my friends loved to sing, and she would be part of a group that would go in, and they would go into as part of hospice. They would just go sing and provide soothing music for
Yes.
people and
Yeah.
things
Music
like that. That was
therapists.
one.
We have music therapy.
Oh,
Yep,
okay,
yep.
see? Because music apparently, yeah. So anyway,
Yes.
that was one thing.
Right.
But what are the other ways?
Music, we have massage therapy,
Oh.
pet therapy,
Aromatherapy.
aromatherapy.
Yes, we offer several different extra services on top of, the ones that we have to offer per regulations. But and we're really proud of that. And I will
That's
say
pretty
our
cool.
massage therapists are in love with hospice. They said it's the most rewarding step they've ever taken in their massage therapy career. So, and we do have them go to, all the facilities, homes. They do many
That's pretty
things, so
amazing. I
it
had no
is
idea.
So amazing.
Yeah, that is. Oh my
We're
goodness.
really proud to offer that.
Oh wow,
Yes.
yeah.
Right, and our volunteers, like Allison had mentioned, we still want them to have good days. So if our volunteers want to go in and do art or puzzles,
Sure.
or read the newspaper
Watch
to
a movie.
watch a movie, or just sit next to them quiet and hold a hand. Those are all the things that make volunteering so wonderful and giving back. And I think a lot of our volunteers know this, that you're giving something and not receiving something back, and that's the big takeaway when you're volunteering in hospice care. Some other ways that we have volunteers coming in, I have high school students that will come into the office and just help with office filing that we need done, because they can see the background of what goes into a hospice agency. So if they're looking at a career maybe in healthcare, where would they want to be? Do they want to be working with the patients, or would rather they be the administration
Sure,
part? So they
sure.
get to learn that.
And high school kids are looking for community service
Right.
hours a lot of times.
Yes.
So I never even thought this would be
And
a way
the
to
ones
do
that
it.
we've had at the office are amazing.
I bet,
They're,
I
they're
bet.
amazing kids.
Yeah.
They
What a
really
life
are.
lesson for them. Yeah. So.
And I even have elementary schools making craft projects or cards that we're able to go
yeah,
in.
yeah.
And it just puts a smile on our patients' faces. They're getting something sweet and innocent, and it might bring back to their childhood or their grandchildren or even their children when they were that age. So it's something
And our
special.
volunteers too do reach out to our families as well, especially around the holidays, to make sure that they have everything that they need, or if there's something that they do need, to see if we can obtain that for
Wow.
them. So we do check-ins with them, just to all the families, to make sure that they're receiving everything that they were promised,
Yeah.
and everything that
Wow.
they
Wow.
would need to help
Yeah.
them through. So
We do veterans pinnings. We
Yes.
just did a big veterans events for Veterans Day, and I was able to we were out in.
Now, where was the event? Where did you go? You did. Did you go into?
It was one of our buildings, and not all the veterans there were our patients, but we still did the pinning for all the veterans in the
included all of
facility.
them.
yes,
Yep,
it's
and,
beautiful.
And I was able to get some of the city councilmen come in and give
This is
speeches,
huge.
and the
That's
mayor,
huge.
and just to say thank you to those men and women who fought for our country. That we're here and we still support you.
Yeah.
Is something nice to be able to give back to
And all I
them.
keep thinking about is when there was a time of COVID when people couldn't get the services, and all those people that there were, and then you think of the value of, because it's the loneliness, I think, and the isolation when especially when they don't have family members, and you become it.
Exactly.
Right? You become
yes,
it.
and we do, and we will increase our services for those
Yeah.
people that need
don't
more,
have
that don't have anyone
a fam-
else.
yeah.
And we do work with, we collaborate with many private caregiving agencies too. So if families need a private caregiver to hire, we're able to make those recommendations, and many of them do same day. I can be there today if you need me, and they are able to administer medication. So we have a lot of outreach services that we're able to help connect
Wow.
people with as
Wow.
well.
This is something.
Yeah.
Yeah.
And also with our volunteers, I like to reach out with them weekly to see how they're doing, just to see how their life's going, because
To the volunteer, to
right,
look out for them as well.
too, because this can be tough on them too when they get close to one of the patients, or if something's going
that's
on in their
true.
home, or if they have a loved one at home sick, how can we be there to help them?
But that's true, isn't it? The work that anyone in hospice does, and you have to deal with this all the time. In the big picture, are there emotional supports for
Yes,
all
there
of you
are.
guys? Okay,
Yes,
yeah.
because our work is heavy.
Yeah,
So
of course it is.
many times our social workers always check in with the staff around them to make sure that they're doing okay. We also, outside counselors too
Good,
for
good, good,
even our
good.
social workers
Yeah.
who may need it.
Of course.
Our team, I think our team is amazing. Where, every one of our patients we carry in our heart, a little piece of them in our heart for sure. But we know our job is to go in to make sure, like, the expectation is that eventually end of life is going to happen. We're going to keep them comfortable. We're going to support the family through it. And that's kind of how we're able to deal with the loss too. But we do suffer the loss for sure.
Of course you do.
But we have to know where to put that
Yeah.
in our own space. I definitely have had patients in my time that, still every day I wake up thinking of them. And not because anything was bad, but just maybe a conversation we had together or something. And, hopefully you provided them the comfort, the emotional comfort.
Well, to
on
do
top.
the work you both do is you have to be so empathic and sensitive, and with that comes all the, the feeling and the loss
for sure,
and all
yeah,
that, right?
definitely.
Right? It's just it goes with the territory, doesn't
Yes.
it? Yes, it does. Is there anything else on volunteering? Like how would people, if they wanted to help, how would they go through? Can you tell us how, if people wanted to volunteer?
Sure, they can reach out to us in hospice at our Worcester location.
Yeah.
And if I'm not in the office, our great staff, will reach out to me, and I'll reach out to a potential person that might want to volunteer. And then usually I try to set up a meeting if I'd like to do a face-to-face or a phone call to see if this is something they really want to get into, or how else could they help volunteer if they don't want to be contact with patients. It could be, like I was saying, working with kids or with students, and providing art classes or art gifts for our patients.
Sure.
It could be any way.
So when we think about this area, sort of this, outside of Worcester, and we've got Franklin and Millis, all of these towns around here. So there's obviously people who might need it in the home, but then there's also some nursing homes in our area. So you must be, are you affiliated with, I mean, not affiliated, but if they need, they can call you there, any of the nursing homes that are in Massachusetts?
Yep.
I mean,
We have
right?
plenty of contracts in Care One facilities. We go to St. Mary's Healthcare in Worcester. There's several assisted living facilities, but even if we did not have a contract with a particular facility, we are able to work a contract with the facility.
Beautiful.
So we're able to go in and take care of the
Got
patient.
it. So anybody then, if
doesn't
they
matter,
need,
yeah.
that they can contact you, and then you'll guide them in the journey. You'll guide them to how they can access it and all the steps along the way so that they can get the care,
Yes.
right? Yes.
Absolutely.
So is there anything else before we end that you want to make sure that's out there that we didn't address in the conversation? Is there anything else that you feel is important? I just don't want to leave it because this is such an important conversation, and anything else? Or
I would just like to say, if you feel like maybe, or if you're wondering more about hospice, to feel free to call Ascend Hospice in Worcester, Mass.
beautiful.
Our office phone number is 508-229-8390. I am a hospice nurse, but I'm also the executive director. I'd be more than happy to speak to any family ever.
Beautiful.
And you can, just make sure that you have all of the information you need to make a better decision for your loved one or yourself. And I think that that's really important, that, it's okay to call us and just to have a conversation to get more information before you make a decision.
Absolutely.
So
Oh,
for
that's
hospice
great.
care.
That's
Because
helpful.
sometimes it's necessary or, needed, but somebody thinks it might not be yet.
Right, and they need to know.
Correct.
Okay, right.
Yeah.
Right.
Because we don't want to come in late in the game,
Right.
because then we're rushing to get to know them, to know the patient.
I think that's one of the most important takeaways I've had from this is don't wait,
Right.
don't thinking you ask questions, call, get the
Exactly.
information. There's no, don't be worried about looking silly or asking the wrong questions. It's just
Absolutely.
get in there early. That to me, that's something. Yeah.
Well, even the same with volunteering.
Yeah.
Call, ask questions.
Yeah.
We don't just send you in there not knowing anything
Yeah.
about the patient. You know, I'd like to have a conversation about the patient. I usually go to meet to be the first visit. We let, you know, family members are there to introduce, so everyone knows who is who and a little bit about the patient going in, so they're not scared, because it's not, death isn't scary if you're educated and know what you're going into. That's what I want the volunteers
Yeah.
to feel comfortable and know a little bit about each of our patients.
That's a huge job in terms of training volunteers, making them feel comfortable. That's hugely important in this whole thing, I would think. Yeah.
It is, and
Yes.
Susan's recruited many volunteers
Yeah.
now, and we're really proud of that because she does such a good job
Yeah.
informing
I
them
can
of
tell.
what you know they're really there to do, and
Yeah.
and so they're awesome. We love them, and we always will take a volunteer.
Absolutely.
Right, and I'd like to say to your audience, especially when you're 18 years old, you know, come volunteer for
Yeah.
hospice. We live in a day and age that everything is so quick with social media and that instant gratification, which you're not going to get in hospice care. You're giving and not expecting to receive
That's right.
anything back. And
That's
I think
right.
it puts a new perspective on a young person's life.
Oh, no
and
question.
it did for me when I was in my early 20s in college.
I'd say, like I
So-
said, it's life-changing and a part of character development and helping you kind of form your values at a young age. You really realize what's important. It isn't so much about the Kardashians and getting lip implants and
Right.
things like that. You know, it's like making a difference in the world and going out there and changing things. So
Yes.
I have to say thank you to both of you for coming. You came a ways to come here for this interview, but it's really important to me. And the more people who know about it, then I can sort of become an ambassador out there for you as well, because the more I
Absolutely.
have, right, and all the people who are listening. So I just want to thank you both again. Okay, it was a
Thank
pleasure
you.
meeting you, and
Thank you.
thank you. And I want to thank everyone for joining us today. I want to thank our producer, Chris Flynn, and Franklin Cable TV and radio and its importance to our community. And thank you for supporting your local cable channels, because it really does we really do bring important conversations out to the public. So thank you all again, and we'll see you next time.
This program was made possible by your Franklin friends and neighbors, good folks just like you. Thanks for supporting Franklin TV. And thanks for watching.